I'm Elayna Nunley with Baptist Hospitals of Southeast Texas, and we wanted to give you an overview of what it's like to begin your new life now weight loss journey with us, offering through services with Bariatric Service Line with Dr. Alex Ordonez, certified bariatric surgeon. You would have your first consultation with Dr. Ordonez, and his clinic would also be able to look up any insurance benefits you would need for surgery, any type of screenings, and your lab work. You also go through a thorough education overview with what's needed to better prepare you for surgery.
The first thing that I talk to patients about on the first visit is about the actual surgery. Some of my patients, they already know what they are looking for because they've had experiences before, either with family members or friends. Some others, they don't have any knowledge about surgery. So it's important to me and obviously for the patient to make sure that they understand really well about the weight loss procedure they're looking to have. I think that nowadays there's two main operations. One of them is the sleeve gastrectomy, which is a really popular surgery. It's become really popular in the past 5 to 10 years. But I also talk about a gastric bypass in some of the patients because I believe that not every patient is a good candidate for a sleeve. Most of them are, but the sleeve is not an operation that we have to force to do it on every patient. Once we talk about the benefits, the good things about surgery, we also have to talk about the potential risks, which are low, but it's important for them to know that there's potential risks involved with surgery. We make sure that we set up the blood work that you mentioned, and we make sure that we set up the follow-up appointments, including with the referral providers and the follow-up visit with me in my office.
Those referrals will also have you have some additional evaluations. You would need to visit with a registered dietitian regarding any changes needed right then prior to surgery, get some education regarding your preparatory diet that you would need to be ready for surgery, and begin your learning phase regarding those diet changes after surgery for success. So we do also have you have an evaluation with an exercise physiologist because we want to see where your status of movement is now and if there would be any further restrictions you would need after surgery. We do know overall success happens when you coordinate all of these areas of diet, exercise, and use the tool for having bariatric surgery. Dr. Ordonez would also need to review all of your labs and then would need to put together a packet that would be provided to the hospital. That packet would be reviewed again to be sure everything's completed and all results are within your packet for review and ready for your day of surgery. Please stay tuned and we'll have some more tips for you getting ready for your new life now.